Hello everyone, welcome to all. In the last video, we have discussed about the science of amelioration and science of aggravation. The science of amelioration and aggravation we can observe immediately after giving medicine to the patient within few hours, few minutes, few hours in acute as well as in chronic cases. We discussed about the science of improvement or science of amelioration and science of aggravation. Then we also discussed about what is amelioration and aggravation. So this was the last video, and the aphorisms given during to go through the aphorisms, where aphorism 253, 254, 255, 256 and aphorism number 273 and 274. Okay, this was in the last video. So today in this video I am going to explain the further part of the same topic, amelioration and aggravation. We saw what is amelioration and aggravation. Amelioration means diminution or decrease in the original symptoms of the patient without addition of any new symptom. This is amelioration. And aggravation means increase in the intensity of the original symptoms or addition of new symptoms which were not present before in patient. So this is what is aggravation and amelioration. So in today's video I am going to explain little bit more about amelioration and aggravation. So if amelioration is clear that the patient's symptoms get ameliorated and there is no addition of new symptom, and at the level of mind and disposition we can find comfortable, a patient feels comfortable, his energy level increases, his confusion goes off, or his capability to do his regular activity comes back, he comes back to his original state. That is what is amelioration. In aggravation, we have to consider two types of aggravation. First is homeopathic aggravation and second is medicinal aggravation. So in the last video we saw aggravation means what? Increase in the intensity of the original symptoms of patient, that is homeopathic aggravation. And second part was addition of new symptoms, new troublesome symptoms which were not present before, which were not present in the totality, or which were not present before starting treatment. If we see addition of these new symptoms, appearance of these new symptoms, then it is called as medicinal aggravation. So we in this video today we are going to talk about the aggravation, homeopathic aggravation and medicinal aggravation. So where it is given in the aphorism, I am giving references of Organon of Medicine 6th edition, but all these details are also present in the chronic disease book volume 1 and volume 2. So if possible, go through the aphorisms which I am telling you, and also go through the various topics mentioned in index of chronic disease book, the chronic diseases book. So I am giving reference from Organon of Medicine 6th edition right now, and you can go and read the chronic disease book also. So where it is given in the Organon of Medicine about homeopathic aggravation. Homeopathic aggravation is mentioned from one aphorism 157, 158, 159, 160, 161. In these aphorisms everything is mentioned about homeopathic aggravation, and where Dr. Hahnemann has mentioned about medicinal aggravation in aphorism number 248, 249, 250 and its footnotes 135 and 136. In these aphorisms, at various places, in various aphorisms, Dr. Hahnemann has explained about homeopathic aggravation as well as medicinal aggravation, but in these aphorisms which I have just told you, in those aphorisms Dr. Hahnemann has clearly given all information about homeopathic aggravation and medicinal aggravation. So if we see amelioration in patient, then what to do? If we see amelioration in patient after giving homeopathic medicine in acute as well as in chronic cases, if we observe amelioration in patient, then what Dr. Hahnemann has told us to do? Dr. Hahnemann has told us, this is given in aphorism number 246. Every perceptible, progressive and strikingly increasing amelioration during treatment is a condition which, as long as it lasts, completely precludes, means completely prevents every repetition of the administration of any medicine whatsoever. Okay, so what Dr. Hahnemann has said, if we observe amelioration in patient after giving homeopathic medicine in few minutes, few hours, after in acute as well as its chronic cases, then we have to prevent or we have to stop repeating the homeopathic medicine for that patient. Okay, this is given by Dr. Hahnemann in aphorism number 246. Then what is given by Dr. Hahnemann in aphorisms about homeopathic aggravation and medicinal aggravation? Dr. Hahnemann says, if we see homeopathic aggravation means what? The same symptoms which were present in patients have increased in intensity, but there is no addition of new symptoms. So that time what we have to do, what it does mean, does it mean? It means the dose which we have given is little bit larger than what is required. Dr. Hahnemann has said that we have to give little stronger dose in acute as well as in chronic cases. We have to give little stronger dose so that that stronger dose can stimulate our vital force, means it will show the primary action. This medicine will show the primary action on vital force, which will help vital force to cure the disease. So we have seen in previous aphorisms, stronger artificial, stronger similar, stronger artificial disease will help to cure the weaker original disease. So this is the thing which creates the homeopathic aggravation, because our dose is little bit stronger than what is required. So we are going to see homeopathic aggravation in acute as well as chronic, which is prognostic sign for us. In aphorism number 158, Dr. Hahnemann says, the slight homeopathic aggravation during the first hours a very good prognostic that the acute disease will most probably yield to the first dose. Okay, so it is a very good prognostic sign that our patient is going to be better after this medicine. So homeopathic aggravation is always a prognostic sign that our medicine is correct and we are going to get result, we are going to get cure in that patient. One more twist is there in this. Homeopathic aggravation we observe in acute diseases at the beginning of the treatment or at the beginning of the cure process, but in chronic diseases we observe this homeopathic aggravation at the end of the cure. Okay, we observe the return of original symptoms which were present before in chronic diseases and the end of cure. So that means here we have to say that now patient is getting cured from the chronic disease and we have to stop the repetition of the medicine. We have to stop the medicine. We have to just give placebo to the patient. Same likewise in acute diseases also, after giving medicine, if we observe homeopathic aggravation within few hours, within few minutes, then we are sure that our patient is going to be get cured, but we have to stop the medicine or we have to repeat the medicine with more interval, or we have to stop the medicine or we have to repeat the dose after some interval. Okay, so this is homeopathic aggravation in acute diseases and homeopathic aggravation in chronic diseases. Homeopathic aggravation in acute diseases we observe at the beginning of cure process, and in chronic diseases we observe at the end of chronic diseases. Okay, so what Dr. Honeyman says, if we observe such aggravation, homeopathic aggravation, if we observe such homeopathic aggravation in acute or in chronic case, then what we have to do, the doses in that case must then be reduced still further and repeated in longer intervals and possibly stopped several days in order to see if the convalescents need no further medicinal aid. Okay, so if we observe homeopathic aggravation in acute as well as in chronic cases, then what we have to do, we have to reduce the dose. Okay, the dose should be reduced still further and repeated in longer intervals and possibly stopped several days to see whether medicine is required, any more medicine is required in that case or not. Okay, so just now we have seen what is homeopathic aggravation. When we observe this homeopathic aggravation in acute cases, when we observe this homeopathic aggravation in chronic cases, and if we observe homeopathic aggravation, then what we have to do. This is these all three things we have seen just now. Now we'll go further for medicinal aggravation. So medicinal aggravation is mentioned by Dr. Honeyman in Aphorism 248, 249, 250 and its footnotes 135 and 136. So what is medicinal aggravation? Appearance of new symptoms, new troublesome symptoms which were not present before in patients. Okay, so in that case this is medicinal aggravation, and medicinal aggravation is always, we can observe this medicinal aggravation always at the beginning of treatment in acute as well as in chronic cases. We can observe this in the beginning only. Okay, so immediately we will get to know whether our homeopathic medicine is right or wrong by observing these signs of homeopathic aggravation and medicinal aggravation. So Dr. Honeyman says, what we have to do if we see new troublesome symptoms in patient which were not present before. So what we have to do, see in aphorism number 249, Dr. Honeyman mentions every medicine prescribed for a case of disease which in the course of its action produces new and troublesome symptoms not appertaining to the disease to be cured is not capable of effecting real improvement and cannot be considered as homeopathically selected. It must therefore either, if the aggravation be considerable, be first partially neutralized as soon as possible by an antidote before giving the next remedy, chosen more accurately according to similarity of action, or if the troublesome symptoms be not very violent, the next remedy must be given immediately in order to take the place of the improperly selected one. Okay, so when homeopathic aggravation occurs, when the medicine is right, our homeopathic medicine prescribed to the patient is right, but the dose is more or it is repeated frequently, then we observe homeopathic aggravation in acute as well as in chronic cases. And if the homeopathic medicine is not the similar medicine, it is a partially selected remedy, then it causes medicinal aggravation. So if we observe this medicinal aggravation, that means the appearance of new troublesome symptoms which were not present before, it itself indicates that this remedy is a partially selected remedy. And if we observe medicinal aggravation in the patient, then what we have to do, we have to neutralize the symptoms or neutralize that state of the disease by giving an antidote for that particular medicine, or if it is not of very violent character, then we have to select the another homeopathic remedy which is the most similar medicine for the state of the disease. Okay, so what we have seen in this video now, what is amelioration, what is aggravation, what we have to do if amelioration occurs, if we observe amelioration in patient, what we have to do if aggravation occurs, what is homeopathic aggravation, what is medicinal aggravation, why homeopathic aggravation occurs, why medicinal aggravation occurs, and what we have to do if we observe homeopathic aggravation, and what we have to do if we observe medicinal aggravation. Okay, so in these two videos I have discussed about amelioration, aggravation, and today's video what we have to do what we have to do in homeopathic aggravation and in medicinal aggravation. Okay, this is for today's video. If you like this video, please share it with your friends, colleagues, teachers, and please like the video. Please subscribe for this channel so that you will get to attend more these videos or watch these videos related to homeopathic topic. Okay, thank you very much.